Estelite Flow Quick is a low-viscosity, light-cured, radiopaque, submicron-filled composite resin. Direct placement of Estelite Flow Quick into a prepared cavity makes handling easy. Estelite Flow Quick's superior strength is excellent for restoring posterior teeth. The ultra-quick curing time also helps reduce chair time. In addition, excellent shade matching is available in a rich variety of 17 shades. 1UP Bond F Plus is a self-etching dental adhesive that permits a simplified clinical procedure, eliminating the need to pre-treat a tooth when performing direct composite restorations. It may be applied on exposed cervical dentin and the root surface as well. 1UP Bond F Plus does not require a separate etching or priming step. 1UP Bond F Plus does not require water rinsing or air blow for drying. 1UP Bond F Plus has built-in color coding. The color of 1UP Bond F Plus will turn from yellow to pink upon mixing, and the pink color will disappear upon light irradiation. In addition, 1UP Bond F Plus also releases fluoride. Estelite Sigma is a light-cured submicron-filled composite resin. Estelite Sigma contains 82% by weight silica zirconia filler and composite filler. The use of such fillers results in lower shrinkage of the material. Every inorganic filler contained in Estelite Sigma is a spherical submicron filler with a mean particle size ranging between 0.1 to 0.3 micrometers. This enables excellent gloss retention and wear resistance. Estelite Sigma is indicated for use both in direct anterior and posterior restorations, including occlusal surfaces. Estelite Sigma is also radiopaque. It is available in both syringe and PLT dispensers. This video will demonstrate 6 clinical cases. The first, a micropreparation involving a Class 1. The second, a deeper preparation, also involving a Class 1. The third case is a Class 2, using a sectional matrix. The fourth case is a Class 3. The fifth case is a Class 5 restoration, and the sixth, a midline diastema closure. The first case involves the quick incremental placement of Estelite Flow Quick in a micropreparation Class 1 restoration. Here, a lower premolar with a small carious lesion is being cleaned and prepared. In addition, the adjacent molar also has some pitting in the occlusal surfaces. The 1UP Bond F Plus is scrubbed on the tooth surface for approximately 10 seconds. There is no need for separate etching or a primer bond, as the 1UP Bond F is a self-etching primer bonding agent in one step, and light cured for an additional 10 seconds. Here, the Estelite Flow Quick is placed incrementally in 2 mm layers in the tooth cavity preparation. Another 2 mm increment is placed in the cavity preparation. And is then cured for 10 seconds. The occlusal portion of the cavity preparation is filled. Cured for 10 seconds, is finished, the occlusion checked and adjusted, and polished. In case number 2, a Class 1 cavity preparation is demonstrated. Here, an existing failing amalgam is easily removed using a high-speed burr and copious amounts of water under rubber dam isolation. The remaining amalgam is removed, followed by explorer examination of the cavity preparation. Then, 1-Up Bond F Plus is applied and scrubbed on the tooth surface for 10 seconds. If required, additional 1-Up Bond F Plus can be applied to the cavity preparation. The 1-Up Bond F Plus is then light cured for a total of 10 seconds. The Estelite Flow Quick is then placed in the floor of the cavity preparation as a liner for the initial placement and cured for 10 seconds using this LED light. A second layer of Estelite Flow Quick is applied to the cavity preparation. And then again light cured for a total of 10 seconds. Finally, Estelite Sigma is applied and sculpted into the cavity preparation. It's important to sculpt the composite at this point in time as it makes finishing much easier following curing of the material. The Estelite Sigma is very easy to handle and stays where it is placed. Estelite Sigma is cured for 30 seconds. And a final layer is placed in order to assure a good seal and excellent anatomical form. The Estelite Sigma is cured for 30 seconds, followed by finishing and polishing. Here the Estelite Sigma is finished and proper occlusal anatomy is sculpted using a carbide fluted finishing burr with copious water and irrigation. Primary and secondary anatomy is formed in the occlusal surface, is then finished and polished, followed by checking the occlusion. Here, a Class 2 restoration is demonstrated. An existing amalgam with associated caries is removed, followed by examination using an explorer. Because of the short height of this tooth, a bi-tine ring is not placed. However, a sectional matrix with a wedge can be easily placed in this area. The 1-Up Bond F is applied and scrubbed into the tooth for 10 seconds, followed by light curing for an additional 10 seconds. The initial placement of Estelite Flow Quick is placed into the cavity preparation as a partition along the matrix. This is followed by an additional amount of Estelite Flow Quick in 2mm increments, this time placed against the matrix band and along the floor of the cavity preparation. Additional amounts of Estelite Flow Quick are placed into the undercuts and areas that would be otherwise difficult to reach using paste composite resins. The remaining occlusal layers are placed in 2mm increments using Estelite Sigma paste composite and sculpted to the tooth with proper anatomical form. These layers are cured for 30 seconds each. Followed by the shaping and polishing of the occlusal anatomy and tooth using carbide burrs as well as polishing points. The occlusion is verified, checked, the tooth is repolished, and the patient dismissed. In this case, a Class 3 preparation is created, removing a defective composite restoration in this upper right canine. Here, carious material is removed using a high-speed burr and copious water. Here, remaining caries was detected using an Explorer. The Explorer was then reused to evaluate for any remaining caries in the preparation. Following this, a small amount of enamel is reduced at the cavo surface margin in order to allow the composite to easily blend into the tooth surface. A mylar strip is placed between the teeth and 1-Up Bond F Plus is scrubbed into the cavity preparation and the prepared enamel for approximately 10 seconds. The 1-Up Bond F Plus is light cured for 10 seconds. An initial increment of Estelite Flow Quick in an OA shade is placed in the base of the preparation. The OA shade is an opaque shade that impedes light and prevents shine through or graying or discoloration from appearing through the black surface of the oral cavity. It's on this shade that the conventional Vita shades are built. Following this placement, the Estelite Flow Quick is syringed through a hole previously created in the mylar strip. And is cured for 10 seconds. This step is again repeated until the majority of the cavity preparation is filled. The final incremental layer is placed into the preparation and the mylar strip pulled over the facial surface of the tooth in order to provide a complete fill. Should this be inadequate, additional layers of Estelite Flow Quick can be applied. The final layers of Estelite Flow Quick in this case were A2, since the non-opalescent or regular shaded Estelite Flow Quick is transparent in nature and provides for excellent aesthetics and a chameleon-like effect when placed over existing tooth structure. Following the filling of the cavity preparation using Estelite Flow Quick, the surface is finished and polished. In this fifth case, a Class 5 restoration is restored easily using the Estelite Flow Quick material. Here, the margins are beveled at the cavo surface margin to allow a smooth, easily placed increment of the final layer of Estelite Flow Quick. The 1-Up Bond F Plus is scrubbed onto the tooth surfaces for 10 seconds each, followed by curing of each tooth surface for 10 seconds. The Estelite Flow Quick is placed incrementally in 2mm layers and light cured for 10 seconds each. In many cases involving Class 5 restorations, whether these are caused by abrasion or abfraction, these lesions tend to be in teeth that are often darker in shade and in older patients. Very often these can be restored easily using a single color called the cervical shade. Here, the Estelite Flow Quick is placed in 2mm increments, cured for 10 seconds, and built up in layers until completion of the cavity preparation. Using the applicator tip, the material can be sculpted to place to allow for easier finishing upon completion of filling the tooth. The two premolars are completely filled now using the Estelite Flow Quick in the cervical shade, and are finished using fluted carbide burrs, as well as silicone points and cups. This shows the finished case, showing excellent aesthetics and adaptability to the tooth. In this sixth case, we will demonstrate a midline diastema closure. Here, a small amount of enamel is removed in order to allow a nice blending of the composite onto the tooth structure. In addition, surface staining is also removed using a high-speed burr. Here, the 1-Up Bond F Plus is scrubbed on the tooth surfaces for 10 seconds each, and followed by light curing for a total of 10 seconds. Prior to this case, an impression was made of this patient's upper arch. The teeth were waxed to correct the midline, as well as the incisal length, and a polyvinyl matrix formed on the model. This is then transferred to the mouth and allows for easy placement of the Estelite Sigma paste. In this case, we're using the shade A1 Estelite Sigma composite paste material. It's sculpted on the upper right central incisor against the tooth as well as the putty matrix. Using this technique, it's easy to see the tooth take form and shape almost immediately. Estelite Sigma is cured for 30 seconds, followed by the placement of additional Estelite Sigma to close the midline diastema. Again, it's important to see why the use of this matrix is so critical and helpful in many of these cases, because it allows us to sculpt the composite exactly where we need to using a visual aid as well as a form to place the composite against. Here the composite is blended to the tooth surface using a composite sculpting instrument. It's also very important to make sure that the composite is sculpted into and up against the gingival surface of the tooth to avoid future gingival health problems and to promote excellent gingival health, as well as allowing the patient to maintain good home care. Here, Estelite Flow Quick is placed on the gingival 2/3 as well as a small portion of the incisal area for the final facial layer and light cured. Here, the upper left central incisor is now going to be corrected using Estelite Sigma composite. The initial layer, the A1, allows for incisal translucency. This will be followed by the use of the OA1 at the midline in order to block out any gray discoloration coming from the inside of the mouth. Here, in a small deviation from the first technique used on the upper right central incisor, a small increment of Estelite Flow Quick is placed at the incisal edge in order to provide a completely restored incisal edge. Here, the putty matrix is now removed, and the midline finally closed. A mylar strip is placed between the two central incisors, and Estelite Sigma in the OA or opaque A shade is placed to prevent any gray shining through at this area. It is cured for 10 seconds, followed by the final placement of the Estelite Flow Quick on the facial surface, and is cured for 10 seconds. The mylar strip is removed. Now that the midline diastema has been closed, the composite can now be finished and smoothed and polished using a series of carbide burrs, small diamonds, and composite polishing discs. The final facial surface is then polished using silicone cups, and the case complete.